Zymaxid drops are a type of quinolone antibiotic that is used specifically for treating bacterial eye infections, like conjunctivitis. It's important to note that this medication is only effective for bacterial eye infections and will not work for other types of eye infections. It's crucial to use this medication as directed and avoid unnecessary use or misuse, as this can decrease the effectiveness of the antibiotic. It's recommended to use the prescribed dosage of Zymaxid drops as directed by your healthcare provider and to use it at the optimal timing for the best results. Make sure to use Zymaxid drops exactly as directed by your doctor for the full time prescribed. Stopping this medication too soon may cause the infection to return. Before applying the eye drops, wash your hands. To avoid contamination, be careful not to let the dropper tip touch any surface. Tilt your head back, look upward, and pull down your lower eyelid to create a small space. Place the dropper directly over your eye and put in the prescribed number of drops. Then, look downward and gently close your eye for 1 to 2 minutes. Use your finger to apply gentle pressure at the corner of your eye near the nose to prevent the medication from draining away. Try not to blink or rub your eye and do not rinse the dropper. If you use other types of eye drops, make sure to wait at least 5 minutes before applying the other medications. While using this medication, do not wear contact lenses. Make sure to sterilize contact lenses according to the manufacturer's directions and consult your doctor before using them. If your condition does not improve in 7 days, be sure to inform your doctor. Some possible side effects of using Zymaxid drops include blurred vision, watery eyes, headache, eye irritation, pain, dryness, redness, and a bad taste in the mouth. If any of these side effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. Many people who use Zymaxid drops do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any severe side effects, such as persistent eye redness or swelling of the eye or eyelid. Using Zymaxid drops for extended periods or repeatedly may lead to a new fungal eye infection. It's crucial to follow the prescribed duration of use and to contact your doctor if you notice any new or worsening symptoms. While rare, a very serious allergic reaction to Zymaxid drops may occur. Seek medical help immediately if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Zymaxid drops, make sure to inform your doctor or pharmacist about any allergies you may have, especially to quinolone antibiotics like ciprofloxacin. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to let your doctor or pharmacist know about your medical history before using Zymaxid drops. After applying this medication, you may experience temporary blurred vision. It's important to avoid driving, using machinery, or doing any activities that require clear vision until your vision has returned to normal. If you are pregnant, Zymaxid drops should only be used if clearly needed. Be sure to discuss the risks and benefits with your doctor. It's unknown whether this medication passes into breast milk, so consult your doctor before using Zymaxid drops if you are breastfeeding. It's important to be aware of potential drug interactions with Zymaxid drops. You should keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. If someone accidentally swallows Zymaxid drops, it can be harmful. In case of overdose with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication is prescribed specifically for your current condition and should not be used for any other infection without your doctor's approval. It should not be shared with others. If you forget to use a dose of Zymaxid drops, use it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and continue with your regular dosing schedule. Do not use a double dose to make up for the missed one. When storing Zymaxid drops, it's important to keep them at room temperature and away from light and moisture. Avoid freezing the drops and do not store them in the bathroom. If the solution changes color, becomes cloudy, or contains particles, it should be discarded. It's essential to keep all medications out of reach of children and pets. When it comes to disposing of Zymaxid drops, do not flush them down the toilet or pour them into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. It's a good idea to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.